Hello, my name's Adrian Bauman from Sydney University in Australia, and I'm pleased to be speaking to you today. I will be talking about promoting physical activity at local, national and global levels using a systems approach or a whole system approach. This talk will describe what is a systems approach, how does it fit with the World Health Organization and related national policies for physical activity, what is good practice in systems approaches. I will also give you some examples from Japan of community-wide physical activity programs, and we will talk about evaluation and challenges in systems approaches. Why do we need a systems approach? We need this because physical activity is influenced by multiple factors, and that solutions need multiple agencies more than the health sector alone. This is true in Australia, it's true in Japan, it's true in every country. We have WHO targets to reduce population levels of inactivity by 15% by 2030, but this is on track in only a few countries. This suggests we need new, innovative and more comprehensive approaches to promoting physical activity. A very good paper by Tessa Strain looked across the world at countries' progress towards meeting their WHO physical activity targets and classified progress as on track or off track with high or low certainty as to whether we would be meeting our targets by 2030. Most countries were unlikely to meet this physical activity target, including Australia, most of Asia, Africa and the Americas. But comprehensive approaches are more likely to help us meet these 2030 targets. Here you can see the countries likely to meet the physical activity targets by 2030, on track in blue and off track in red or in orange. You can see that most European countries are on track to meet the physical activity targets of WHO, but most of Asia and Australia are off track. In other words, we don't look likely to meet our targets, and this means we have to take new approaches to promoting physical activity. A systems approach is for complex problems. Traditional research and evidence generation, we tested small-scale studies, interventions in small parts of the system, but we're trying to change a complex behavior, and this rarely influences physical activity at the population level. Systems thinking takes account of the interactions amongst different agencies and different groups to solve the problem of inactivity in society. It's useful for complex problems or where solutions have not been effective. And it needs to address social factors and environmental factors that influence the problem of inactivity. We can work in different ways in systems approaches. We can take a complete or whole systems approach, a systems-informed approach that uses some of the principles of systems thinking, or analyze part of the system. And there are also different levels of systems. A whole population is a system for a national plan, a regional or city level system or local system, and there are other systems such as the school is a system, a primary care system, a work site, a transport system, a healthcare system are all described systems. We need to take a practical approach to using systems thinking. We need to plan for partnerships with the municipality or stakeholders. We need to wait for a good time when there is a window of opportunity for action, because systems work requires capacity, resources, sufficient time frame and partnerships. We need to measure the implementation of systems to assess progress, And ideally, we also need to focus on some level of medium-term impact or outcomes. Some principles for planning systems approaches. Population change won't happen from a single intervention trial in volunteers. That's not generalizable evidence. We need to consider the interactions across system factors that influence physical activity choices, whole communities, social norms, environments, and workplaces. A systems approach identifies and develops interventions to target these underlying and interconnecting causes of physical inactivity. We need the commitment of partners, we need leadership and coordination. By definition, systems approaches reach more people in the population and will reduce inequalities in physical activity. This is because they involve multiple sectors and multiple agencies. Sometimes we use qualitative methods such as interviews or focus groups to identify systems' needs and inequalities in real time. But we're targeting and measuring whole populations or whole systems. One challenge is that systems need to be flexible and be able to adapt and adjust programs in real time. And these will differ. They'll be different in different communities. We have put together some slides and videos in Australia of the Australian systems approaches to physical activity, and I just include this slide if you want to follow up and look at more information. Similarly, we have written a book online which is freely downloadable called Getting Australia Active, which is written for policymakers but has information about systems approaches that are generalizable to policymakers everywhere. Those chapters may be of interest. Systems approaches are not new in health promotion. We've been doing this for quite a long time. We started in 1986 with the Ottawa Charter, in the early 2000s Health in All Policies, and more recently the Sustainable Development Goals, all take a systems approach in their thinking. In other words, they focus on the interconnection of multiple agencies, multiple government departments to achieve change in physical activity. This concept is fundamental to a systems approach. Let's look at some examples of systems mapping and modeling. The GAPA Global Action Plan on Physical Activity by the World Health Organization is well known to many of you. It is called More Active People for a Healthier World. It uses a systems approach. There are 4 clear areas where interventions need to be developed and part of the national plan needs to happen. Creating active societies, creating active systems, creating active environments, and creating healthy, active people. These 4 circles are surrounded by the actions that need to happen in what's known as a systems map. We have drawn systems maps for any country using a generic map, which we published for the World Health Organization, which you can refer to. But I'll take you through the planning stages a little bit more. We've written about building a systems map to look at how you build such a map, to look at what are the influences on physical activity in your nation, in your community, in your municipality, in your worksite. We start the process of systems mapping by thinking about the core influences on human movement and physical activity. Individual psychology, individual responses to social environment and norms, individual characteristics, age, sex, whether people have chronic disease, and individual physiology. We then look at the 8 best investments for physical activity, and think about which of these areas are important in our system and which are we going to work with. School programs, community programs, workplaces, active travel, sport and recreation, active urban design, healthcare, or public education, including mass media. We then remember the WHO Global Action Plan and the 4 policy areas that we have already discussed: active environments, active systems, active societies, and active people. We then start the process of mapping the connections across the system, and this results in something called a systems map. It looks quite complicated, but describes the different relationships across all the different areas that we want to work with. The 4 inner core areas, the 8 best investments or the best investments that you choose, and the strategies and ways in which we can develop system level enablers and leverage points to make those things happen. We can also see through a systems map how interconnected things are, that each of the systems areas is not in isolation, but is linked to and has benefits and consequences for a range of other areas. An example of a national systems approach is the Irish National Physical Activity Plan. In Ireland, it took 8 years of planning and advocacy to develop a national plan that used a systems approach, but is an excellent example of one at the national level if you're thinking about national use of systems approaches. And what the Irish National Plan does is it's chaired by health and transport and tourism and sport, by 4 sectors. So it's multi-sectoral and multi-agency with university and academic engagement. It's informed by the Toronto Charter and the ISPA 8 best physical activity investments. It targets all areas and has got 8 theme areas and 60 actions with a 4-year time frame, and has a strong focus on implementation to monitor the National Physical Activity Plan actions. How you build a systems map is you have a meeting with all the stakeholders. Bring them into a room. It can take half a day or a day, and you get them to build a systems map for the system in their city, their workplace, their municipality, or nationally. It depends whether those stakeholders are trying to build a system, at what level, what kind of system they're trying to build. But this process is something that is very interactive and engages with all relevant stakeholders. This is an example from the Caribbean countries, which are a group of small island countries who developed a systems map for all of their countries in the 4 GAPA areas, and have local adaptation of GAPA specific for Caribbean nations. So you need to be able to be flexible. Not all systems maps end up looking the same. This is one in a city, Derby in England. The program was called Derby on the Move. And this is you can read about this in the publication, but is another way of mapping at the municipality level and developing a map. And what that tells you, I'll show you in the next slide. It defines areas for intervention. Each of these pink circles defines areas. The one on the left encourages built and natural environment interventions. The small one at the top encourages changes to social norms, how people think about physical activity. And the one on the right says we've got to have something that targets individual citizens and gives them opportunities to be active and targets them with specific programs. So the interventions were suggested by the systems mapping process, which were then implemented by the municipality. The strengths of system mapping are they help us understand the influences on physical activity much more than one single study. They then help us plan what are the strengths and weaknesses, what assets do we have to help us do these things, and what do we need, what are our priorities for action, which parts of the system should we work on first, and it helps us understand how interventions might work. The action is it tells us what to do and who our partners need to be, who we need to have at the table to develop and implement these interventions. And evaluation says, well, what are we going to define as success? And I'll talk more about this later. I'm now going to spend a couple of minutes talking about the situation in some community-wide programs in Japan. These are city-level interventions to promote physical activity, which are examples at the system level, but you could use systems thinking to apply to a national setting in Japan or a large workplace or other more local systems. These are just city-wide examples because they've been published and because they are good examples of systems thinking. But so you could apply systems thinking to your national physical activity plan. The problem there is bringing all the national stakeholders, all the senior ministers from government into the room at one time is often quite difficult. Okay, here are a couple of good examples from Japanese cities. One good example is the community-wide physical activity intervention in Unan City Hall, which Kamada has published in 2013, 2015, and 2018. This is a cluster randomized controlled trial in 12 districts and has the theme of communicate and targets adults. It's testing can this work and has strategies to be visible using social marketing. It's multi-component, involves multiple organizations and settings, and has the strategies of providing information, education, and engaging with the community. The results showed an increase in knowledge, increase in awareness of the physical activity guidelines, and those who increased their knowledge were more likely to increase their physical activity. Another example of a systems-informed physical activity intervention is the community-wide project in Fujisawa City, which used a quasi-experimental design with 4 intervention and 9 control administrative units. It targets particularly older adults and is trying to get 10 minutes more physical activity for people living in Fujisawa. It's based on Healthy Japan 21 strategic framework, and it promoted walking and exercise programs. It's a systems-informed project because health promotion collaborates with many other agencies, including the City Hall, community and senior centers, pharmacies, shops, post office, even banks. This is a good example of a project that uses a systems approach. This Fujisawa project had good implementation with good reach into the communities and good evidence of working with multiple organizations. The research collected baseline 2- and 5-year follow-up surveys and showed at 2 years that the intervention community was more aware and better understanding of physical activity guidelines than control communities, and had high reach and high distribution of materials to increase physical activity awareness. At 5 years in 2018, physical activity for older adults had increased 15 minutes more per day than those younger, aged less than 64 years. Inequalities also decreased. The planning process that made Fujisawa a systems-informed project included the analysis with municipal agencies, mapping strategies against the World Health Organization Global Action Plan and the Sustainable Development Goals, and working with a range of partners in planning social welfare, senior citizen, sports sector, and KEIO University. It's building towards a systems approach. And you can see in the figure above, there is a clear planning process that involves many stakeholders, and in the figure below, a clear link to both the WHO Global Action Plan and the Sustainable Development Goals. So for my last couple of minutes, I'll give you some comments on evaluation and some summary comments. Researchers are interested in understanding the system, but also outcomes focused. Did the system change work? And we need to think about evaluation for whom. Are we evaluating for the community who want us to measure engagement and local actions? System researchers want to understand the system, often using realist evaluation and systems modeling. And policymakers want to monitor priorities. What are the population changes we see? What have we spent our resources on, and what have we got back in terms of pragmatic changes at the population level? Systems evaluation is complex, requiring multiple methods and various research designs. You have to monitor system processes, monitor partnerships and engagement with stakeholders and the community, understand the interventions and how they are adapted and evolve over time in different communities, measure success through system enablers, things that support the system, and measure change at the individual, organizational, and environmental level. It's important to plan this evaluation. When should you be measuring outcomes? Usually it takes several years. When are the endpoints, and what endpoints should you choose? Obviously, we all want more people to be more physically active, but when are we going to measure each outcome, and how are we going to measure that? These are considerations, things to think about in planning your systems level evaluation. So the reality of systems approaches is they are expensive, a long-term commitment, and they require interagency, intersectoral collaboration solutions to difficult, complex problems. It requires government or municipality or city hall to have a long-term solution, long-term commitment to sustain this approach. So sometimes we do a bit of systems. We consult, we draw systems maps, we plan, we maybe do modeling, we identify our actions, but it's difficult to implement sustained solutions long term. This is the biggest challenge we have with systems. In conclusion, systems approaches are potentially capable of making a population difference. We need to identify the system's components and hypothesize how they will change. We need to evaluate different aspects of system implementation and change. We need to identify the barriers to systems approaches, including the difficulty of maintaining partnerships, the high costs, and the difficulty in sustaining interventions for years. But we also need to remember the co-benefits of systems approaches to physical activity. This benefits other sectors, including climate change, urban planning, community cohesion, much more than just health outcomes alone. Thank you.